So I think I talked to most of the groups about this, but I just want to reiterate that this is all like preparatory work for the actual movement, right? So this isn't going to be like your full treatment session. This is something where you're coming in, maybe you're talking to the patient, asking about how they did overnight, how are they feeling, do you have pain? And once you're comfortable, you're just kind of doing, how was your night last night? Did you get some sleep? Hopefully they didn't take blood at 6, right? This is like something that's happening where I'm setting him up and then I'm like, all right, let's roll and let's go. In general, I think there's concepts in PNF that you learned, right? Like some of the quick stretch and some of the situations where we want the muscles to be excited. But if somebody has hypertonicity, then we don't want to use those techniques, right? Typically, we're using these techniques to kind of get somebody positioned who has hypotonicity. Hypertonicity. If they have hypotonicity, like we don't necessarily also need to use a PNF pattern to excite because this is really just about prepping the position. But if we're getting into a position where we start to do the rolling and the person's reaching across their body, or we're getting into a position where they're actually doing the scooting and we may need their leg to, maybe be a little more active, that's when we might think about some of the other techniques that you learned in the PNF patterns. That makes sense? Okay. So typically in patients with stroke, I'll use them as an example because I think this is the most common diagnosis that you're going to see. We have some hypertonicity in the upper extremity, and then the lower extremity we have extension, right? So we have like plantar flexion, we might have some abduction if they are falling out like this with external rotation. Sometimes it's internally rotated but still in this extended area. So same thing here, right? We're getting into a position where we might want to do a little bit of rotation. We're starting proximally, maybe a little distraction. And then once we are into a place where we can do some weight bearing, right? Following the loosening of the muscle, then we want to start to send some weight through the joint. So then, typically he might be out here like this. So we might be in a place where we kind of are slowly loosening this area, getting a little bit of dorsiflexion as well. So breaking up that synergy pattern of that full extension. Yeah, that makes sense? So she has her hands placed in certain areas, and then it all depends on kind of which muscle group you're trying to weight bear through, which muscle group you're trying to excite. So if we're starting here, first we need to be able to get that flexion. Once we get that flexion, we might be in a place here where I might start to want to weight bear a little bit more through the hip or through the foot, depending on kind of where everything's holding up and staying. Does that make sense? Do you guys have questions on this slide before we move on? No? It's kind of the same concept as the upper. It's not an exercise. It's not how I'm going to spend 30 minutes of my session. It's because we're going to scoot or we're going to roll. So I want to kind of make sure that we can use the body the best we can. Somebody?
So when we're doing those inhibitory facilitation techniques, either for upper or lower, are we doing for all the 3 joints? Like if it's the lower hip, knee, and ankle, quickly, and then we can start the movement?
Yeah, I mean, I think it's going to be dependent on your patient. If I can get Antoine, right? If I get Antoine in a position without doing all this, right? If he has a little bit of tone and I could just go like this and break it and get him here and say, let's scoot, then I'm going to do that. So there's no sequential order that you have to do everything. This is why your movement analysis is so important, because if I ask him to roll and he's in this position and his leg just kicks out as he tries to roll and the task cannot be completed as a result of that, then I know, all right, let's get back onto your back. Let's try to loosen up a little bit your hip, and let's try this again.
Gotcha.
Yeah, that makes sense?
Yeah.
Okay. Let's see if we can go through a few things so you